Tamara Rachel would like to begin.
Sure. Thank you so much for having us, Judy. We're really excited to be here to talk about the Legal Help Desk. And you can see we're from CJE. It's our 50th anniversary year, so we're very excited. And the title of today's talk is Legal Services Lead to Better Health, which is sometimes something that you may not realize. And so that's the focus of our talk today. CJE, just in general, is a comprehensive community-based organization that enhances the quality of life and facilitates independence for older adults. And you can see on this slide, I don't expect you to read everything, but just the wide range of community and residential care options that we have, honoring the unique needs that older adults have, and focusing on all aspects of wellness, social, emotional, physical, spiritual, financial, intellectual. What we'll talk about today, you can see right here, is your legal health. So our Legal Help Desk is modeled on a medical legal partnership. And what a medical legal partnership is it's a partnership between legal providers and medical, and in our case, social providers, to address legal problems that may harm your health, that may have an effect on your health that your physician or other healthcare provider can't address. And these medical legal partnerships have been shown to positively impact clients' health and well-being. So one of the examples that I like to use is if, for example, you are someone who has asthma and you keep your doctors provided you with the best medical care, but there's something wrong with your house. There's mold growing in your house and your landlord isn't taking care of it, and it keeps exacerbating your asthma. You keep going to the emergency room for these asthma flare-ups. There's nothing your doctor can do about it, but a lawyer can help address that health problem by helping fix that housing issue. And we'll talk more about that later. So just a brief overview. The first medical legal partnership actually started here in 1993 at Boston Medical Center, when a pediatrician grew frustrated by watching his young patients fail to make clinical progress because of housing problems or food insecurities. And so Dr. Zuckerman hired a part-time attorney from Greater Boston Legal Services to meet his patients' unmet needs in these areas. And actually, I had the honor of working there when I was a law student back in shortly thereafter. I won't date myself too much. And as of now, there are actually 450 medical legal partnerships across the nation, but only 30% of them represent older adults and help older adults with their legal needs. So there are a lot of legal needs that don't get addressed. 56%, according to the Legal Services Corporation, there is a justice gap because 56% of older adults have at least one legal need, and 10% have 6 or more legal needs, but 87% of those legal needs don't get addressed. And up to a third of those legal needs are health related. It's having proper health insurance or being billed incorrectly. Sometimes it's income issues that can also affect your health. And so we recognized that this was a huge problem also here. So we created the Legal Help Desk to meet some of those needs. And there are a lot of reasons why these legal needs go unmet. So first of all, sometimes someone doesn't even know they have a legal issue. There's a problem, but it's not identified as a legal problem, so they don't know to go for legal help. Another portion of people know they have a legal problem, but don't know where to get the help. Some people can't afford the help because they're worried about the cost. So some legal services only address people who are at 175% of the federal poverty level, so that people who maybe have a slightly higher income can't get legal services help, but also can't afford a private attorney. Here at our legal help desk, we help anyone regardless of income. And finally, there are just simply not enough lawyers addressing older adults to go around, partly because of the income caps and partly because of other eligibility guidelines. So what happens when your legal needs go unmet? So the same survey that found that 87% of these legal needs were going unmet also found that people say it really affects them very much or severely, and often has cascading effects that go beyond the legal problem. And it can lead to increased anxiety and depression and stress. Of course, if you have a legal need that's not being met, it can lead to unsafe housing if there's a housing problem that's not being addressed, or even eviction. And sometimes if it's denial of benefits or other income issues, it could be a lack of adequate food or medication. So one of the things that makes medical legal partnerships successful is they address the social determinants of health. And that's a pretty broad term. And what it means is that our health is determined by things other than our access to healthcare services or even our personal behavior. And it's shaped by where we live and the services in our community and what our community looks like and what our laws and policies look like. So I bet you'd be surprised to know that actually 60% of a person's health is determined by these social factors that we call the social determinants of health. And because that's true, that's why these medical legal partnerships are successful. So the medical legal partnership community has come up with an easy way to remember what these are, and they turned it into the acronym IHELP. And what that stands for is income and insurance, housing and utilities, education and employment, legal status, and personal and family stability. And in a minute, Tamara is going to go into much greater detail about how these translate into the legal help that the Legal Help Desk and other medical legal partnerships provide. And what has happened here is that the medical legal partnerships and the Legal Help Desk at CJE use this acronym to create a screening tool to help us identify the legal needs of the older adults who come to see us. And I am going to now turn it over to Tamara, who's going to go into greater depth about how she addresses each of these legal areas.
Hi, everyone. I'm Tamara Kushner-Groman. I recognize some of you from the presentations I've done with Judy in the past, and I'm so glad that we can be back to chat again today. If we can go to the next slide, please. The Legal Checkup. So first of all, just by way of introduction, I am a licensed attorney who practices here in Illinois, and I am the lead practicing attorney on this project, and I work closely together with Rachel, who does a lot of our evaluation and other information about our legal help desk. So I do a lot of the work along with my paralegal, whose name is Sam. So in case you give us a call and you call me and it ends up that Sam calls you back, you just should know both of our names. What's going to happen when you call for a legal checkup? What's going to happen? So first of all, we ask a lot of questions, and some of those questions feel very personal. So I do want to make mention that anything that is shared with me or Sam, in the context of an intake phone call for our legal help desk is confidential. So I can't share it with anyone. The biggest reason I ask a lot of questions is because we can't give accurate legal advice without knowing the full picture of what's going on. So for example, I get a lot of questions about home ownership. So if I want to retitle my house because I want to leave it to my kids after I die, should I do it this way or should I do it that way? Well, you may or may not realize that I then need to know more about your health insurance. You might say, well, my health insurance, what does my health insurance have to do with the title to my house? Well, if a person receives Medicaid for their health insurance, then we want to title the house appropriately so that it won't affect the Medicaid status going forward. Also, if you want to leave your home to perhaps your adult children, it's going to be important for me to know whether any of those adult children or their children have any special needs or if they receive public benefits. So I'm not trying to get, into your personal business for any reason other than trying to give you the best and most comprehensive guide to whatever the legal needs that you have. The other thing I want to make mention of is we may need to research your particular legal need. There are so many different legal questions that we get. And I'd like to think I'm pretty good at answering questions, but I can't answer them all. And I can't do it all necessarily like right when you call me. So we may need to research your particular legal need. As far as our legal help desk also, there are certain areas of law where we don't take cases directly. For example, we don't do anything with criminal law. It is outside the area of our practice. However, if you did call me with a criminal law question, I do have referrals ready to give to you on any subject, I think, that you might ask. So even if I can't answer your question directly, I can most likely get you to someone who can. Next slide, please. So going back to our I help model, we're going to start with income insurance and insurance. So yeah, we know income, it's one of those challenges. And living on a fixed income in retirement is not easy. But a lot of people don't realize that insufficient income can have downsides for your health. For example, medication affordability, right? If you are not taking your medications according to the way your doctor is prescribing them, then let's look into that. Is that because you're not getting all the benefits you're entitled to? Certainly, Miss Judy Jordan is a SHIP counselor, and certainly we also have SHIP counselors at CJE. And come fall, you may want to review your drug plan. But insufficient income, that's just one piece of a challenge that could cause a downside for your health is if you aren't able to either afford your medications or whatever other medical appliances, food, etc., that is recommended to keep you healthy. Good food and nutrition is linked to good health, right? There should not be a need to choose between food and other necessities like heat and medication. But we know that there are, and we know that that does happen, right? So again, coming to a place like CJE with a legal help desk, right, means you also get the benefit of all the rest of our CJE services, which includes our resource benefits team that can help make sure you're getting the SNAP benefits you're entitled to or other benefits that may help. We also may be able to help empower you to contact your physician. That drug, you prescribed me costs $300 a month. Is there a drug that might do the same thing that costs less, right? And help empower you to have those conversations. Good insurance. Good insurance means, fewer out-of-pocket costs. Now, good insurance means good insurance for you. The right plan for your friend, your neighbor, or even your spouse may not be the best insurance plan for you. The other area that income certainly affects is safe housing, which we're going to talk about on the next slide, and thinking about the ability to weather some kind of emergency. whether that emergency is a car repair in order to get you to work, and how might that affect your ability to maintain your income, um, and so the repair of a major appliance, things like that. Income is certainly an area we look at. The other thing about income is looking at your Social Security income. For people who may be receiving SSI, it seems that the Social Security Administration woke up recently and is sending everybody overpayment letters. I can understand how nerve-wracking that can be, whether you're on supplemental security income or Social Security disability, and navigating the waters of Social Security to be able to maintain your income is an area that we can help you with here at the Legal Help Desk. Next slide, please. So housing, area number 2 in our iHelp model. So your housing needs to be safe, affordable, and clean, right? Your housing needs to be a place also that you want to come back to. It's important both for your physical health and for your mental health. Being able to have stable housing that is in a comfortable and safe environment for you to return to every day if you're working, or know that you can stay because your heat works, right, in a terrible snowstorm, or your unit can be cooled appropriately in the summer. Stable housing means fewer emergency room visits related to homelessness. And certainly consistent heat, housing, and electricity helps people follow their medical plans. Housing and income certainly go hand in hand. Especially thinking about things like appliances and being able to warm your food or cook nutritious food, right, certainly adds to the element of affordability and health. Next, we're going to talk about education and employment. Now, I don't know how many folks here are employed, but I know many older adults are employed either full or part-time, often to supplement the income that Social Security provides. And consistent employment at any age helps provide money for food, shelter, and medication, right? Those are our major 3 areas that we want to make sure every person has access to: food, shelter, and medication. The other thing when it comes to education, access to education, even such as the resources from Weiss at Weiss Hospital and our programs from CJE Senior Life, can lead to better health outcomes. In part, knowing when to seek help. So everyone knows to seek help in that immediate emergency, right? God forbid the car accident, things like that, right? It's automatic to call 911. But other times, knowing when to seek help is sort of confusing. I recently had a client who was confused about a medical form. And she was hesitant to seek treatment for herself because she didn't understand the medical release that the hospital she was in wanted her to sign. And she was afraid they might deny her treatment down the line. So thankfully, she called me. We reviewed the medical document. It was not the way she was reading it. And instead, I was able to assure her that it was fine for her to sign the document and explain fully what the document meant. And then she proceeded to get the health care she needed. So know that honestly, that case was 15 minutes, but it had a major health outcome to this person who is now receiving the medical help that she needs. Also, access to education, avoiding financial and medical scams. And we could talk about scams for a whole hour, but we're not going to do that today. I can certainly talk to Judy about coming back and doing some future sessions, but avoiding both financial scams and medical scams is a huge area of education that can help keep you healthy and safe. Next, we're going to be discussing legal status. So I do have some great referrals for those who have questions specifically on immigration issues, but access to your public benefits, public housing, can often require a credit history and understanding your credit history and how that might work, how to build credit history, how to improve your credit score. All of those kinds of things are certainly things we can help advise you on. And that's why we may ask questions regarding your credit and other information. It's to make sure you're getting all of the benefits that you are entitled to. Veterans discharge status can also affect your ability to get other public benefits and certainly jobs, which you see how it all ties back in together. The next slide about personal and family stability. I know this is the big topic that has been already discussed in this group, at least a start of a discussion. So I would say the bread and butter of our legal help desk, the thing I see most often is advanced care planning issues. So just so you know, at our legal help desk, we can assist you with creating and getting till full completion, signing, notarizing, etc., your powers of attorney for healthcare, your powers of attorney for property, a living will if appropriate, and a last will and testament. But we like to approach advanced care planning. A lot of people think advanced care planning is all about how I want to die. And I'm here to tell you, advanced care planning is all about how you want to live. Because if you are choosing a person, if I have to pick a person who's going to choose my nursing home, if I have to pick a person who's going to hire my help at home because I'm unable to do so myself, I want to make sure my agent knows as much as possible about what I want in my life. So I can tell you personally, for me, being outside is like top of the list important to me, right? I am a person who needs to be able to get outside. So if someone had to choose a new home for me, a condo for me, a new apartment for me, or an assisted living, right? For me to be able to access the outdoors would have to be one of the most important elements of what I want that person to choose for me. So for those who have really thought mostly about, oh, advanced care planning is just that I either want to stay alive as long as possible, or I don't want to be connected to machines at the end of my life, right? That's just the tip of the iceberg of some of the discussions we can have about advanced care planning. So powers of attorney, there are two of them. One of them is called a power of attorney for healthcare. And that, of course, is the document that says, if I can't make decisions for myself, this is the person I want to make healthcare decisions for me. That one is pretty familiar to most people. The other one is called a power of attorney for property. And in legal terms, the word property means your stuff, your money, your bank accounts, what you own. So it's not just property, meaning land or a house or condo, it's everything that you own. So a power of attorney for property gives another person the right to make financial decisions for you in the event you are unable to do so for yourself. So those are both extremely important documents. I get a lot of calls about guardianship, concerns about what might happen if I need a guardian for myself, or concerns that perhaps a loved one didn't make an advanced care plan and is now unable to take care of themselves. For those of you, I haven't seen, I don't know the demographics of the whole crowd here, but I do want to mention that our legal help desk can assist anyone age 60 plus, or where the legal issue affects someone age 60 plus. So I often am assisting the adult children who are trying to help their parents navigate new waters of advanced care planning. Guardianship is certainly an area that has been coming up a lot, because once a person loses the ability to make decisions for themselves, that person can't sign a power of attorney anymore. It's too late. So then we need to explore guardianship with a court appointed person to make those decisions. Household safety and cleanliness. I feel very fortunate as a lawyer sitting in an office with an entire social service agency at my back, essentially, or on my team, I should say, because there are many issues where someone might contact me about one issue. And through our discussions, we realize that there may be some other issues at play. For example, a person who tells me that a foreclosure is pending, and I ask for copies of certain documents, and they say, well, the house is really messy and disorganized, or there's so much stuff everywhere, right? And that might be sort of a clue to me that this person might just need a little more support at home, right? And we have a care management team who can offer that support at home. And if they can't offer it directly, they can help connect you with someone who can get you that support at home. So household safety and cleanliness is related to so many health issues, making sure you have hot water so that you can be clean, so that you can maintain your healthy medical regimen as prescribed by your physician. I know Rachel gave an example earlier on about asthma, which I think hits home really clearly on what a medical legal partnership does. Another area specifically around cleanliness is a client who needs to have a particular surgery, but because of their personal hygiene, the physician is concerned about a rate of infection. But if it turns out that the person is living in a housing situation where they don't have a bathroom that can be properly cleaned or maintained well, right, then the person might not have access to the health services that he or she needs. So going on to the next slide, some of the questions we may ask at our CJE Legal Help Desk checkup is, have you chosen someone to help pay your bills? And I don't mean financial assistance, although we could discuss that also. That's where that power of attorney comes in, right? Have you chosen someone to help with healthcare decisions? And for those of you who have, kudos to you. I'd still love to talk to you a little further, because a lot of people may have chosen their agent, the person who's going to make the decisions, but they may not have had those discussions about what kinds of healthcare decisions you want someone to make for you. So here at CJE, we have our CJE Guide to Healthcare Advanced Directives. And it includes a lot of those questions you can work with, you can use to think about for yourself what you want in the event somebody else had to make decisions for you. And I'm happy to send some of those to Judy so that when Weiss at Weiss is reopened for in-person visits, she could give those. She could give those out, or they're available on our website. So I may ask questions about income and benefits, problems with housing, or any problems in your family. And, you know, all of these questions lead back to that I help model, where all of these things that might not feel legal or they might not feel medical end up being very intertwined in your legal needs and your healthcare needs. So my job is to serve you and to serve as an advocate. And I am, I think that was my last slide. It was. Rachel's going to advance to the next slide, because how can you reach me, right? So on the screen right now, the email address, legalhelpdesk@cje.net. And that phone number on the screen is my direct phone number, with one caveat that I get a lot of phone calls. So we do our best to respond to new callers within 48 hours. But with email, it may be slightly faster. So that's why we're putting both of those up on the screen. Rachel is going to be putting something in the chat. So we're not going anywhere. We're going to stick around and answer questions. But we do strive to keep our presentations as high quality and with the best information as we can. And to that end, we ask just for your input or responses for an evaluation. So for those of you who are familiar with using the chat, at the very bottom of your screen, you'll see a little button that says chat. And if you click on that in just a minute, Rachel's going to be putting in a link for an evaluation that you could take now or towards the end of the program, whenever works for you. So at this time, I'm happy to open it up to any questions that you could either put in the chat or raise your hand or shout them out. We're happy to answer questions. Ted?
Okay, that's
sorry.
actually Gimme. Do you have a question, Gimme, for them? You know what, if you can speak back at my computer, because the volume is off.
Hi.
Hi.
Okay, my name is Yemi, and I think I'm used to this CJE. I used to go to the lecture there. I don't know what happened when the pandemic thing happened, so I never heard from. But my question is, I have Medicare and Medicaid, and I know you have the senior daycare in the place too. So I would like to go back to joining the activities over there, either giving you my email or my home address so I can come and participate in the CJE. I think they're on TUI, so I take the TUI bus and it takes me to the place. So my question for this topic is do you have handouts for everything you covered on today's topic?
We are happy to share our presentation today. We can email that to Judy and she can email it out to everyone today. I realize we didn't put it on that last slide, but I'm going to put it in the chat. Our website, which is cje.net/legal-helpdesk. I'll type that in a minute. That has the CJE guide to healthcare advance directives. It has the statutory form for power of attorney for healthcare and for living will. And for your ease and convenience, we've taken that statutory power of attorney healthcare form and put it in 16-point font, so it's super easy to read. So a lot is available on our website. And we can send around the presentation. As for our in-person activities, I am so glad that you enjoyed them in the past. At CJE, we are still in the process of coming back into the office and getting all of our programs up and running. We're still not open in general to the public. We occasionally have clients coming in with certain things, but if you have seen our cyber club programs, so if you use Zoom, use a computer at home, we have programs every day of the week, including art, exercise, education, topics where you just get to come and schmooze with people, all virtually 5 days a week. So if you want to stay on for a minute at the end, and you can give me your email address, I can make sure you're on that Cyber Club website.
Beautiful. That's what I want to give you, my email address.
Perfect. I'll stay on at the end for a minute, or you can give it to Judy, who can send it to me.
Yeah, she'll do it.
Yeah, I'll send it to you.
Perfect. I'm going to go with Shelly, and then I'll take the question in the chat after that. Shelly, go ahead.
Hello, how's everyone?
Hi, thanks for being here.
Thank you for having me here. I understand this meeting is about seniors and it's very good information. However, does this apply to young adults?
Does this apply to young adults? That is a good question. In general, our program is geared towards those age 60 and older. If you have a legal need that is really only affecting a young adult, whether that's an educational need for school or whether the person is outside of school and has other legal needs, that's really outside the scope of what we do. But again, if you'd like to call me so I can give you some guidance as to other legal organizations that also offer free legal services, I'm happy to do that.
Yes, I'll be calling you. Thank you.
Okay, my pleasure.
This is
Yes, so thank you, Rachel, for answering that question in the chat. All of our services are free of charge, regardless of income. Now, that doesn't mean I won't ask about income because it is an issue that could affect the advice I give you, say for estate planning or for housing or for bankruptcy or any of the myriad issues. I will ask about your income, but it will not affect my ability to provide you with services.
I have a quick question for you.
Yes.
Someone says, I am fairly organized, but I need help in distribution of what happens after I die. Is this something you could help organize for them?
Sure. I think that there's two parts in my mind to that question. One is the physical organization of items, whether that's physical items that you have accumulated in your lifetime and you want to think about them and dispose of them or donate them or give them to loved ones. And the second part of that is organizing your legal affairs to have a smooth transition after you die. So certainly the legal affairs I can 100% assist with. I know at the beginning of this program, someone mentioned that they were out of state. I just want to be clear that I can only assist people who are dealing with estates or any other legal matters in Illinois. So if you just happen to be on vacation, no big deal. But I just want to mention that I am only licensed in Illinois. So helping you get the legal documents in order, transferring property, listing beneficiaries, reviewing all of that, I can absolutely do. With respect to organization, CJE certainly has amazing referrals for people who can come into your home, who can help you make a plan for what you want to happen with your belongings later, or even getting more organized now to remember what you have and decide how you want to distribute it. I see that people are putting email addresses in the chat. So if you're putting your email address in the chat, I'm assuming that's because you want to be added to our Cyber Club list for information about all of our events, which is amazing. We send out, a Cyber Club generally sends out an email on Friday for all of the events the coming week. So I just thought I'd mention that. And I'll take down these email addresses to make sure I pass those on.
Adam, I'm copying them, Tamara, from the chat.
Thank you, Rachel. All right, my legal need is secondhand smoking. Got it. Thank you for sharing. There's a message in the chat about being concerned about secondhand smoke. It sounds like it might be coming from another unit in the building. I would be happy to discuss that with you one-on-one, because depending on where you live and how you live and what kind of building it is, there's a lot of details that go into how I can respond to that question. But I would be happy to do that if you want to just give me a call, and we can do that one-on-one so I can get a better picture of what is going on.
I have a question.
Yes, Adele.
My name is Young, and this is not a legal question, but spouse is not able to take care of himself and he's over 65, is there any way that I can get help?
Yes. So again, like so many of these issues, it depends on your spouse's financial income and financial circumstances, which may or may not be the same as yours. Not every couple decides to hold everything together.
Mhm.
For some areas of assistance, we have to look at household income, but we also have, for people who do have more substantial means, we do have fee for service programs,
Mhm.
which would be able to get you some help. So whether the help you're looking for is respite or adult day services, CJE has adult day services for those with mild to moderate cognitive decline, where a person can go during the day and have a day of activities and art and educational programs and music. So figuring out what might be the best route for your household is really one of the roles that our care managers play, figuring out what is best for you and making a plan to manage the care of the household. For that, to be honest, I would probably direct you, anyone is welcome to call me. Really, that makes more sense for our general phone number, which is 773-508-1000. And we'll put that in the chat, but that is the main CJE number.
Okay.
And keep in mind that I'm one department in a big organization. So for example, if you're working with someone in our counseling department or our care management department, and it becomes clear that really there's also a legal need, great, we work together because we're all housed under the same roof, right? So we certainly work in partnership with one another.
Thank you.
Sure.
So I have a question too.
Yeah.
So CJE, I was just looking it up. So it's Jewish Values for Positive Aging. Do we have to be Jewish to call you?
That is a great question. And no, we help everyone who calls us. Some of our services are limited by geographic area because our care managers can't physically get to every place in Illinois. But our legal services are open to any person of any faith or no faith, etc., who live in Illinois.
Cool.
And that is true of all CJE services. For example, SHIP counseling, benefits counseling, etc., is available to all people.
And I also believe I just read that it's not for profit.
It is. We are a 501c3 not-for-profit organization.
So you, like Judy at Weiss Hospital, are dependent upon the donations of kind people, and so we don't have to pay for the services that we get from you.
Correct. Our program.
Crazy wonderful.
It is crazy wonderful. The main donor right now for our CJE Legal Help Desk is RRF Foundation for Aging. We also have a grant from the Niles Township Government Center, and CJE gets private donations and we get grants. I will say, for example, our counseling department will bill Medicare. So our counseling department can be paid through Medicare.
Right.
So there are other ways, but yes, many of our departments operate on grants and private funding. So that's how we can keep our services free and affordable for all of you.
Well, to get free legal help, I mean, just doesn't make sense.
Well, luckily for me, I still get paid a paycheck. And luckily for you, you don't have to worry about retainers.
That's unbelievable.
Where are you located?
Where are we located? That is a great question. We are located, essentially, we are at 3003 West Toohey. So it's in the West Rogers Park neighborhood. Essentially, the main cross streets are Toohey and McCormick. For those who live further into the burbs, I also see clients on Wednesday afternoons at Niles Township Government, which is located in Skokie. So for those of you here, kudos to you for using Zoom. I can often do a first appointment via telephone or via Zoom. And then if it comes to the point where we need to have documents signed, then you have a choice. You could come into our offices where we have a notary and witnesses and we take care of all of it. Or I can mail you the documents, but then you have to take care of getting them signed and executed on your own, which is another option. But for some people for whom it's difficult to get into the office, it might be easier to use your local bank down the street to notarize papers or something like that. Just depends on mobility.
Well, I donate a lot of money to JUF,
Mhm.
some of which comes to you guys.
Absolutely. JUF, the Jewish United Fund, is funds CJE. Approximately 10% of our annual budget comes from CJE. But just to give you an example of how big CJE is, a lot of people don't even realize we currently, even though we no longer have Lieberman Nursing Home, we have over 400 staff members here. Our annual budget is $48 million. So we're talking about a big organization. So there's a lot going on here. We didn't even get into all the stuff going on here. But I also, so one area I would like to make mention of, because we have a few minutes, is our counseling department. Look, this pandemic's been hard on everyone. Whether you've been staying in or going out, or have family around or don't have family around, it's changed all of us in some way or another. And for anyone who feels that they're struggling a little bit, they're just not quite sure what should happen next, struggling with reopening, or struggling with changes in family that have happened, or mental health changes or other health changes that have happened in the past 2 years, right? Our counseling department is here and available. And so I am sure Weiss Hospital also has great referrals for mental health. And just to say, like, use it. Use all the resources available to you, because that's what we're here for. Any
Let's
other
speak here.
questions?
I have one other person.
Yes.
So do you ever get situations where somebody has to go into a nursing home and they own a home and then they die in that home a few years later? And who gets that home? Does it go to the family? Does it go to the state because they're picking up the rest of the bill, which the person can't afford? So they get like $1,000 Social Security, and it's a lot more to stay in a nursing home. How do you deal with that type of estate planning?
I absolutely do. Now, I will say I don't often, what you're really referring to is Medicaid planning. So oftentimes, if a person needs long-term care, right, they may, even though they own a home, go into long-term care without selling the home, right? Medicaid can put a lien on the home up to a certain amount that was actually the amount of care given. However, often if we can meet with people early enough, say a person has a very early diagnosis of cognitive decline, right? That is the time to assemble your team, your financial planner, your lawyer, along with your medical team and your care manager. Because the short version, and it's a much more complex issue, is Medicaid has a 5-year look back. So Medicaid is going to look at your assets for the last 5 years before you go on Medicaid and make all your decisions from that. So with all the new amazing medical information, right, people are living longer and healthier lives. It's possible if when that first diagnosis happens, you make a plan, you may not have to lose that house or the entire thing to Medicaid. On the other hand, right, if you're getting good quality care through Medicaid, then it's okay to protect yourself and to say, you know what, I
If you
need
have a
this and this.
daughter, you know, a daughter who's raising 3 kids and she's single, and you know, she would probably, her and her family would probably benefit from that,
And that is
whether
a
they sell it or live there or whatever the situation may be.
absolutely, and that is a beautiful and wonderful thing. To be able to leave an inheritance to your family is beautiful and wonderful and commendable. But I don't want to see anyone do it at their own health expense. And it's okay to put your own health and well-being first. And so we can meet and talk about that. And maybe there's some way to balance those areas.
Thank you for mentioning that particular piece about putting your own health care first, because so many people want to leave their loved ones everything, and I get it. But you have to take care of yourself. You know, think about yourself and spend for yourself. That's so important. Were there any other questions? I did not see anything additional in the chat box that was not caught. But Rachel, I want to thank you very much for repeating the link for the survey, and I can send that link out as well. And what you'll do is, it doesn't always, you can't just click on it and it'll open up, but what you'll do is just copy and paste it into another search bar, and then it'll bring the survey up for you. And then how will they get this back to you? Will it come, how will it go directly? Okay.
It automatically, yeah, it should be clickable. It's clickable for me, but if not, yes, that's a great idea. You can copy and paste it into your web browser. And
so professional, I love it.
Thank you. Microsoft Forms. I wish I could take credit. It automatically captures your response, and I get notified that it's been done, and it's completely anonymous. I don't see who sent it or who commented. So feel free to be completely honest. Your feedback is so important to us, so that as we continue doing presentations, we can meet your needs, and also so we can report to RF on how we're doing on our job of doing the legal help desk, because educating the community is part of that work. It's not just, the wonderful representation that Tamara does, but also educating people about how to take care of their legal needs. So yeah, please, as many evaluations as we can get, we would be ever so grateful. So, and also are grateful for you guys attending today's session.
And besides just saying thank you so very much, Rachel and Tamara, I'm just very thankful. Tamara reached out to me recently, because we've worked together in the past, and I cannot just stress how many amazing programs the CJE has, and it's open to the community, and it's no color preference. It's just sharing with everyone, and a lot of their programming is free. I'm glad that you touched up on the counseling, and that it's taken care of by Medicare. It's covered by Medicare, because a lot of counseling sessions are not covered by Medicare. So if you can seek out an avenue for those of you that are on Medicare and would like to have that service, check out CJE, because a lot of private places, more specifically, do not accept Medicare. It's private pay. And the other thing that I'm glad you touched upon was guardianship, because I don't think we really know exactly enough about guardianship. And that guardianship does come into play, as you said, when you don't have your power of attorneys and your documents in order.
Absolutely. Thank you all for being here today.
Thanks for
to
helping
find
us.
us.
Thanks for helping us get our acts together.
Yes, thank you. They came, it seems to be the flow, because we just had power of attorney, we had the 5 wishes, and we've been talking a lot about power of attorney and about grief, and being where, talking about where we are in this pandemic. So your session just really tied that loop, it's flowing in the same loop, and I thank you so very much for sharing with us. Are there any more questions or comments?
What's for lunch?
Oh, yes, exactly. Oh, I can give her your email. So the other thing is that we had a good attendance. I'm noticing some names that I have not seen before, and I'm thinking I may not have your email. So if you, I'm gonna pull the information here from, let me just stop recording.